Warm Pasifika greetings, everybody. Thank you for taking time to join our webinar today. Also, I'd like to say thank you to our chair, Dr. William Puloka, for the devotions and for welcoming everyone. Our topic is COVID-19 and Fonua Ola, a health promoting way of building the capacity of Pacific families in this time of COVID-19. The reality is that we are a one world, one people, one health. And that's one of the messages that COVID-19 hits home really hard. And that is, home is the foundation, the beginning of everything. And while we are a one human family, everything begins at home. So we might be in our bubble, but we should have a one planet consciousness in our thinking, in our work, in our activities, as we go about conducting our life as members of the family, but also as members of the health promotion workforce. Here in New Zealand, our small but agile team at the Health Promotion Forum, a work team at the national level. At the same time, we have a global family, work family, that is the members of the International Union for Health Promotion and Education. We worked together last year to host a World Conference on health promotion. We continue to work together for the next World Conference in Health Promotion in Montreal in May 2022. So that planetary context is important because it provides the background to our understanding of indigenous knowledge and Pasifika indigenous knowledge and Pasifika health promotion models. So the four key points we're going to explore today. The first one is the indigenous knowledge in a planetary context, Pasifika health promotion in a planetary health and Anthropocene context. We will look at Fonua Ola and finally see how we can apply Fonua Ola to our work as health promoters and other public health workers. So firstly, our planetary context and our social evolution as humanity. We have come a long way from the family and the tribe stage to the nation state or the empire state. And now, increasingly, we are onto the planetary global village states. It means also that the knowledge systems of the world from the West, from the East, and indigenous as well, and also spiritual knowledge systems are now coming together to enrich our pool of knowledge and to inform the way we work together to address health challenges and other global challenges that humanity is facing. So it was very timely last year here in New Zealand that the Health Promotion Forum organized a World Conference on Health Promotion. The theme was Waiora, Promoting Planetary Health and Sustainable Development. Great conference, over 1,000 participants. And among other things, we produced 2 legacy statements. And the 4 areas of action that the 2 legacy statements call on and to for the world community to think about and use were about the well-being of the planet, the well-being of humanity. And you can read the details, and I invite you to visit our website and read the 2 statements. The 4th one calls on the world community to include indigenous people's knowledge in our search for answers to our common challenges, to our common home, planet Earth. At the same conference last year in Rotorua, leaders of public health and health promotion around the world came together. Professor Brent Baum from Australia, one of our colleagues, spoke about the significance of good governance and leadership, whether it's the family or the global level. And she observed the good political leadership in New Zealand, not just the political, of course, but the professional, as we observe today with the COVID-19, great leadership from the political, professional, community, and spiritual as well. Professor Sir Michael Marmot, a world authority on the social determinants of health, also observed part of our good leadership is framing our budget, framing our approach to the well-being of the nation within a broader framework of well-being, not just economic well-being. It's economic, social, it's environmental and cultural. And as we have seen today with the unfoldment of our effort to recover from COVID-19. He highlighted the importance of social determinants, and overall the conference calls for a balance of social determinants and ecological determinants of health. What happens at a global level will impact on the local level, as highlighted by Professor Tony Capone, one of our friends and a leader in planetary health. Again, I invite you. You have the link there to his talks on our YouTube and also on our website to find more details about planetary health. But in short, planetary health is the health of human civilization and the natural systems at the same time on which our health as humans depends on. And at this planetary level, many centuries of advancement in many spheres of life, we have improved our health quite significantly. Life expectancy, poverty is down, child mortality is down, while life expectancy has gone up. But we have done this by exploiting our natural resources of the planet. And this period of environmental changes that are induced by our human exploitation of our limited planet resources is known among scientists as the new geological era of the Anthropocene. You can take time, look at the website of the Lancet Commission and find more details about planetary health and the era of Anthropocene. One of our colleagues at the conference, Professor Trevor Hancock, again, link to his presentation, elaborated on what Anthropocene is. Not only it's a scientific geological phenomenon, it is an ecological phenomenon. It's the impact of humans on the resources of the planet, and it affects our health and other spheres of life. So, indigenous knowledge. We are very fortunate in New Zealand that we have Te Tiriti, not only as a founding document of our nation that protects the rights of the second partner of the treaty, and that is Tangata Whenua, but it also maintains and preserves indigenous knowledge through language and in other forms. And Pasifika peoples, very lucky to have that space where our knowledge can not only be protected, but we can further research and validate and bring into the spheres of education, learning, and with application in the health and social service sectors and across other sectors. New Zealand is not different from the rest of the world. In fact, we are a microcosm of the world. And with all the climate challenges we are facing, we need to reimagine, our current values, institutions and practices. So it's not just in the indigenous space. We are re-evaluating that in other knowledge cycles, as they do in the West and in the East. People are rethinking, and it's something that we should be doing as Pasifika health promoters, as other fellow health promoters. Here is Kate Raworth's donut economy model. Professor Raworth from the University, from Oxford University. Now let's focus on Pasifika or Moana knowledge. And why should we have Pasifika models? Isn't it enough just to have the Ottawa Charter and the Bangkok Charter 2007? Or, why Pasifika models? Different cultural, different ethnic groups view the world differently. Their context, especially at the national and regional level, are different, and therefore the experience is different. The challenges are slightly different, and we need to capture the learning from that and inform our thinking, inform our practice, and inform the way we do our work as we move on. And so, hence the Pasifika models that have been evolved and introduced over the years. You have a list there of the Fonua Ola, Fonofare by our colleagues from the Samoan community and others who help Carl Enderman to bring about Fonofare. There's also Te Waka and Paul Pau. These are some of the Pasifika health models that have been introduced over the last 2 decades in New Zealand. There are also research models like Kakala, Talanoa, Whaawaretui, and Diwaiwai. Primarily, they are research models introduced into the education sector, but they have been used to a smaller degree by some of the practitioners in the Pasifika health space to help their designing of initiatives and projects, and also research and other activities. One thing to notice with models are that they either are metaphors or are based on natural reality. Fonofare is an example of a model that was built on a metaphor. Carl Enderman named his model that he worked on with a number of colleagues, Fonofare, named after his grandmother, but it's about the whare whanau, where the whanau was held, when a wise, wonderful grandmother was born. This is a story that Puimano shared with me when we worked together for a little while. And so it's the metaphor of the whare being used to frame the realities of our Pacific environment. And those of you who are familiar with the whare, there are a number of pillars, a number of poles that represents dimensions of well-being, from the physical, mental, spiritual, and other dimensions of well-being. Fonua is an example of a model that is based on our reality. And let's look at Fonua. Fonua is the dynamic, interdependent relationship of humans and the rest of the ecology. In simple terms, it's about the people and their environment, the people and the land. What it says is that humankind is one with the environment. We are interdependent of each other. We are not outside the environment, and therefore we have a duty to look after Mother Nature in the same way that Mother Nature supplies us with food, clothing, shelter, water, air, medicine, spirituality, beauty. Fonua, therefore, is a natural, but also a social reality, because we identify with Fonua. This theoretical underpinning of Fonua, this thinking, this philosophy, is a contrast to what we observe with some of the models, some of the systems in the West, where we see man, we see humanity being the dictator, being the controller of the environment, being outside the environment. And this is a significant contribution of indigenous thinking to the health sector, to the education sector, because basically we are depicting the reality of life, that humanity is one with the environment rather than separate outside and control and exhaust and abuse the environment. So central is Fonua in our Pasifika thinking. In the Tongan language, it's Fonua, but it's Fanua in Samoan, it's Enua in the Cook Islands, it's Vanua in Fiji. You find that there are certain important phases or states of life in our Pasifika reality where you find Fonua being central. Fonua is the Tongan term for the womb, for the environment is also Fonua. Your final resting place in this physical plane of existence is your Fonua or Fonua Loto. And the next life is another Fonua, it's the new land, it's the new Fonua. So that's how central the notion of Fonua is. And after doing some research over the last 10 years, we thought it was quite appropriate to bring Fonua as a model to the health and education sector. 10 years later, the thinking has been broadened up, the consciousness enlarged, and we thought that it'll be good to clearly identify the dimensions of Fonua. So instead of 5, we include a 6th dimension of cultural well-being. So there you are, you have the 6 dimensions of well-being with the model Fonua, and we include the other significant cultural understanding of what is health and well-being, Ola, to rename the model Fonua as Fonua Ola. So we have the 6 dimensions of the spiritual dimension, the mental dimension, the physical, the socio-economic, the cultural well-being dimension, as well as the ecological, the Atakai dimension. What we have preserved from the initial iteration of the model is the 3, not only the dimensions, but the levels, the 5 levels of the dimension. Because Fonua is applicable at the individual level, the kāinga or family level, to the local level, the national level, as well as the global level. And those 5 levels are equally important. As mentioned already, what impacts at the global level can impact directly also on the local level and vice versa. Today, however, is a focus on the family level. With our reimagining of Fonua, we identified 4 major strategies for Fonua, for its application. There is the research and identify and address the health issues and its determinants. And then you build the capacity of the workforce, or whether it's the family or the locality or the village. And you also put in place some healthy rules or policies. but also to make sure that you distribute resources equitably. These four major strategies of Fonua were based on our experience, both personal and professional, but also inspired by other models that are around the world today. We also include some guiding principles, principles that are familiar with most, if not all, of our Pasifika colleagues in the country and around the world. The principle of reciprocity, very clearly stated today in the situation of our COVID-19, that we are interlinked, interconnected, interdependent. So reciprocity is the way to go. There's also collective well-being, or mo'ui kakato, well-being for all, health for all. The need to be holistic rather than partial in our approach, the katoa approach, and also to be ethical, prudent, and wise in your service and in your leadership, whakapotopoto. So those are principles and strategies that will help in your thinking when you apply Fonua in our work as Pasifika, as other health promotion workers around the country. And you use the 6 dimensions of well-being as the frame to guide and to shape and inform our thinking. And especially when you apply it to the level of the family. In Pasifika communities, in their homeland and in overseas Pasifika communities, you see the family is still, the center and the beginning of everything. The first circle of well-being, and the first circle of advocacy and strong agency of taking ownership of your future and shaping the future you want to walk into. Some of these photos are family photos, just to acknowledge the generosity of my extended family to use these pictures to illustrate. So when you look at the first dimension of well-being, again, the family is the first house of worship. It is also the first preserver and instigator of ethical, spiritual values and principles that will shape and form the identity and the mental and spiritual framework that will guide the individual for the rest of his or her life journey. Principles like reciprocity, equity, justice, love, kindness. The family is also the one that first and foremost inculcates life skills, leadership skills, for instance, to be resilient. It frames our way of knowing and being, again, the identity of the individual in the family. And when you socialize into bigger spheres of life, the locality, the national, regional, and global, you already have a strong sense of who you are as a spiritual being. Again, it's from the family. The family is the first house of learning when we look into the dimension of well-being, and actions like creating a peace bubble, as we have done in the previous levels of level 4 and level 3 in our COVID-19 situation. These are activities that, families with health promoters can work together to instill in place. The ideas that we share in these are just options and examples. But when you work with families, they themselves can consult and decide what activities that are appropriate in these dimensions of well-being as they come together to create a plan, a future that they would like to walk into. In terms of physical well-being, again, the family is the first house of health and well-being. The father and mother can lead with the support of a health promoter, and they decide what activities they can do. As a proud grandfather of 4, certainly the grandparents have a role to play. During this COVID-19, it was a new opportunity to be close and to be working together, learning together with my grandchildren. And I realized the importance of intergenerational well-being, whether it's gardening, whether it's walk, or it's going up the mountain. The intergenerational of well-being within the family, within the whanau, is quite crucial. The dimension of socio-economic well-being, it has been said that Pasifika families are more into social well-being and less into economic well-being. While there might be some truth in that, it's my personal experience that quite a few, and it's increasing in number, of Pasifika families who are into wealth creating. Again, it starts with the family, but there are certain life skills, budgeting, goal setting, that families can be encouraged to come together and put those things in place. Strategic planning, ecological enterprise, the entrepreneurship, where not only you look at the economic and social well-being, but also the well-being of your natural physical environment. Cultural well-being, an equally important dimension, especially for those Pasifika families who are overseas, our diaspora community. Again, the family is the first house of identity creation and the repository of our cultural knowledge. Not only the repository, but we are, as family, the carrier of our culture, our values, our knowledge, our histories. And it's a treasure that families should look into, again, with help of health promoters and other health workers. And finally, the ecological well-being. Fonua built on that reality of Pasifika people, that we are one with our environment. The Fonua is us, and we are the Fonua. It's highlighted in those 4 important phases of Fonua that I mentioned earlier. The womb, the world of the child is Fonua. The physical land to which the child is born is again called Fonua. And when we as mortals pass on to the next Fonua, the hereafter, our physical remains are then returned to the Fonua, in the physical Fonua that we are in. And there are activities that the family can work together with the younger generation in the whanau, in the family, planting a garden, cultural trees, again with a new consciousness, of being global citizens, being members of a one global family. So in a nutshell, that is how you apply the Fonua Ola model. And here's a template that can be looked at as an action plan. The first column has got the 6 dimensions of well-being. Second column, what are the actions by who in the family, and when you do those, carry out those activities, and what are the outcomes that you expect. So a simple tool that you can actually use and apply when you translate Fonua Ola to the family level and working with families. So in summary, from a Pasifika perspective, family is the foundation of society, a very strong agency for promoting health and well-being, first line of defense, of course, and we create our future. We do not just walk into the future, we can create the future we want. And we think globally. The action focuses on the local. So in the Fonua Ola, with its 6 dimensions, we hope that you can apply this tool, this model and framework to how we work with Pasifika families. But I mean, that's in a nutshell what I was wanting to talk about.
Thank you very much, Sione. That is a great talk, and I hope everybody enjoyed the talk as much as I do. And I would suggest that we take 5 minutes break. You can refill your coffee or get up or stretch a little bit. And then when we come back in after 5 minutes, Emma would probably, and I would invite anybody who would like to ask a question to just post a question about. I think there is something there where you can raise your hand, and our administrator here, our IT guru Emma would probably handle that, and then we can have a little discussions before we close the session. Thank you very much. Malo pito. You can play some music, Emma.
Riami, I noticed that I've been trying to speed up and race through my presentation. So
no, you did very well. Did very well.
But people can ask, and I can go back in some of the slides and
it's okay. Yeah.
Elaborate.
I like that. Short and sweet.
Yeah. Yeah.
Yeah.
So you either can post a question through the chat space, or I think you can raise your hand and.
Can't see the raise the hand thing. Where's the raise? Usually you can raise a hand, but I just can't see it.
Or maybe if someone just indicated, then you allow them in, Emma.
On chat. Yep. Oh well, no one at the moment. Malo Aotearoa Sione, could you go back to your last summary slide just to reflect on main points, please? That is simulata.
Yeah. Yeah. So
and
you can do that when you come back. Yeah.
Yep. Yeah. And yes, everyone, this webinar is being recorded, and we will send this out to you. Is this where you start singing, Viliani?
I forgot to bring my voice with me, you know?
Oh, right.
E ku'umoni tu, alia mai, maliu mai oe, papalina. Now you're having your break. You can think of a question and we can continue. How's that?
Lovely. I think that's a unanimous.
No, I think this has been very great. And as people are coming in, maybe, and Sione, you have been asked to go back to your last slide, the summary slide. That's right?
Okay.
Yeah, go back to your last summary slide. But before you do that, I just want to add on something that you said towards the end of your presentation, when you refer to the family as being a very important unit, and realizing that during this COVID-19, actually, the government has been asking the family to be the church because we couldn't go to church, to be the hospital. Actually, the specific advice, if you feel sick, please don't go to work, don't go to school, stay home. So again, your family, your home has become the hospital and the place of worship. And also there were a lot of learning, become your office, work from home, and your school, students, we are advised and encouraged to stay and learn from home. So again, it's really, really emphasize the reality, and maybe it's a way forward that we must look again into the importance of our family, so central to our well-being, because such a time like this, we actually, the hospital cannot do much for you. I mean, while there's no immunization or no medication, home is the hospital. So I thought that I just want to bring up that point there, Sione, related to what you talked.
Yeah, that's very.
But maybe you you can say something about that, and then you go back to your last slide.
Yeah, that's very true, Viriami, what you said about the family. COVID-19 has taken us back to the first unit, of society. As you know, everything begins with the family, and life and health and well-being begins where we live, where we love, where we learn, where we work, where we play, and for Pasifika peoples, where we pray as well. So the family is the first house of spirituality, the first house of worship. But the spiritual dimension is one of 6 equally important dimensions of well-being, for everyone, not just the family. So the summary of the talk is about the 6 dimensions of well-being that the Fonua Ola, I almost said whanau Ola there. Well, there are lots of similarities, as you know. The Fonua Ola model, recommends, put forward. And Fonua Ola is about the well-being of the planet, the environment, and the well-being of humanity, and the dynamic symbiotic relationship. And we find that in the small islands of the Pacific, the close interconnectedness of humanity to nature. The other thing that this model predicts is the need for balance in our approach to well-being and prosperity. The emphasis in the last 300 years, especially in the thinking of Western cultures, is economic, physical, material well-being and prosperity. Whereas the thinking of Fonua and Fonua Ola is about the dynamic coherence between the material and the spiritual. COVID-19 has really shown us that it's not enough to have food, shelter, clothing, and education. We must have kindness. We must have a positive relationship, especially in the family, the first foundation of society, the first of everything. So what Fonua Ola is suggesting, that it's not only about the well-being of families and the environment, but also an approach to life in general, a life that is balanced, a life that looks at the material and the spiritual dimensions of life. That's a central, notion and thinking from an indigenous Moana or Pasifika, philosophy. And that's one of the reasons why I thought it would be helpful to introduce Fonua Ola into our thinking in the health and education space and other spheres of activities.
Thank you very much, Sione. Someone is asking, I think it's Anamani, whether, that little plan action that you have at the back, is it going to go along with the presentation? And I assume it is. So I think it's, it will be part of it. So you can have it, and of course you can modify it and adapt as fits your own purpose and situation. And if I may just add on to what Sione has just been saying about the 6 dimensions of well-being with spirituality, mental health, physical, socioeconomic, cultural, and ecological. The way it is put in the diagram is very interesting because it's in a cycle, it's cyclic. And therefore, if one is not there, the circle will shrink and it's going to be incomplete. So I think the point is that you have to, and we all have to pay attention to each of them. They are of equal value. This it's not that one is, you can just do that one and forget about the others. All of the 6 dimensions has to go together. And the other interesting thing is, it's not a linear kind of way of think where you can start somewhere and then end somewhere. You can actually start anywhere, and that will be your first circle. You know, because maybe your spiritual and academic is okay, mental is okay, but maybe it's your physical is the one that needs strengthening. So we can start there. And then maybe it's a social economic is where the issue is, or your cultural competency is where the issue is. So wherever you need to start, you can pick a point which is most relevant to you, and you can begin at that point, but not forgetting that they are interrelated and interdependent, and you have to be mindful of the rest of the components in that circle.
Just like the tree of Irami, as you said, if I use the tree as an analogy, when you grow a tree from a seedling, you need water, soil, and sun. You can't survive by just having sun and water without soil. You know, you need all the components, you need all the dimensions. The crisis that we are in the world today, it's because of our partial approach to prosperity. We focus so much on economic well-being and physical well-being at the expense of our ethical, moral, spiritual well-being. And as a result, you have our collective global resources accumulated at the top 10% of our human society. And you have situations of abject poverty and inequalities across the world. And when you have challenges like COVID-19, it really, really makes it worse. And it shows, as we have seen for Maori, for Pasifika, you know, here in New Zealand and other parts of the world like the United States. These things are not natural. They are human-made. If you have an approach to well-being that you ensure that you distribute wealth equitably, and then everyone can survive, will have the basic necessities, you know, that you need for life. And if you do not have policies that are holistic, and I think I mentioned that as one of the principles of Fonua, and then you have a society where you see inequity, you know, deprivation. So we need the spiritual dimension of well-being. We need the cultural dimension of well-being. You know, all the 6 dimensions of well-being. Yeah, that's right.
Thank you very much, Sione. And I think probably we're coming to the end of our session here. Not many other questions coming, but we invite you please to contact with us if you have other thoughts to share with us, not just something, you know, of course, we are very good at doing what we're doing, but we also need to hear some of your feedback to keep us honest and keep us, you know, sharpen our own work here, because as we are progressing to the future. And Sione, if you don't have anything else to say, then I can just summarize and maybe we can end this session here. But also we will continue to invite, you know, further webinar. I think the next one coming up in next week, and Emma will be sharing with you those information.
Yeah, two final items from me. One is to inform our participants. They can read more about Fonua Ola on our website. I think I've given the link there somewhere, or in the panel that went out. You know, there's more to the model than what I've shown today. We deliberately keep it, you know, brief and simple for purpose of the webinar. And similarly for the other resources that I mentioned, you know, the links provided for the conference, for instance, and the legacy statements. You know, by all means, help yourself. And this presentation will be shared, of course. And finally, for me, Viriami, a word of appreciation and, you know, heartfelt thanks for to the participants. Thank you for your time, and also for you, Viriami, for your chair and the karakia and everything, and also for the rest of the team. You know, Emma, for the IT side. You know, great to work together and learning together at the same time how to engage virtually with our co-workers around the country. Thank you, William. Over to you.
Yeah, and before we close, I thought I wrote down some few points just to summarize this for all of us, but I'm sure you have taken your notes and you will soon receive the copy of the presentations. But I thought that there was something that came up very clearly. The first point was the emphasis on that we must work together and we must share. That's especially was pressing on us with the COVID-19, the importance of working together. And working together doesn't necessarily mean that we have to do the same thing. No, we contribute what we can, where we are, whatever we are, but the main thing is that we need and we must work together. The second point was important, it came out, the importance of leadership. Especially in time of crisis. Of course, we would, as you are the leader in your family, you are the leader in your organization, you're the leader in your own little bubble. And yes, leadership, we will make a lot of mistakes, but the timing is important that we act precisely and then we make decisions transparently, and then we match any mistake and we learn from our mistake and move on. But leadership is so important. Another point that came out very clearly, of course, that we still very much need to be mindful of the social determinants of health. All the different aspects of social determinants of health, not just physical, not just spiritual, not just social, not just economic, but all of them together, very much like the 6 dimensions of well-being that is summarized in the Fonua Ola model. And of course, the important thing about here that COVID-19 make it very clearly the importance of us knowing and understanding we all share the one home, the one planet Earth. And whatever you do in whatever corner of the world will affect the rest of us. And whatever we do in our little beautiful bubble here in New Zealand will also have an impact on other people. So we must remember that we all share one planet. And of course, the next point there is the misuse and abuse that we human beings have done to our planet health. And the fact that the human impact, Anthropocene, is a term specifically referred to the fact that we human just so big-headed in many ways, and we use and abuse everything else for our benefit. And now those come back to haunt us. And of course, then we came to a point where we talk about indigenous health, indigeneity, the Maori health, and we know the different models in the Maori, the Wharetapawha, the Te Pae Mahutonga, and Matariki. And then Sione shared with us here those Pacific models. And our focus today was, of course, on the model of Fonua Ola. And I think those aspects, and as has been shared before, they have a lot of things in common. But for us Pacific and for us here in Aotearoa, caring is our culture, and we must stick together and we must share our knowledge, and the good and the bad and the ugly days that we're facing is also important to know that we are in here together. And with that, once again, I do want to thank all of you for availing yourself and being with us. And please keep in contact, send us a message, let us know how you're doing. And if there's anything we can do to help, please let us know. And let me close again with a karakia. May the mana of Maui and Tangaroa, with the fellowship of the Holy Spirit, remain with us all till we meet again. Amen.